Hello, my name is Tim Montague, and my two careers are strength and conditioning and physical therapy. Also, I'm not really sure what's going on with my camera. It's showing that it's on, but I'm not seeing anything. I've been trying to figure this out for a few days now. But anywho, here we go. All right, so job description. So for strength and conditioning. Strength and conditioning coach is responsible for establishing and maintaining a strength and conditioning program for all sports. And they're really trying to focus on three major goals, which is improving athletic performance, reducing athletic injuries, and teaching lifelong fitness and movement skills. As a physical therapists plan and execute rehab programs to help patients return to a higher level of physical movement. This usually happens after an accident or surgery of some sort. They also try to manage or lessen any type of pain from a patient that is dealing with any type of diseases or disabilities. And they do this with a combination of physical activity, reflexology, massage, muscular, and skeletal manipulation. Specialty areas. Certified strength and conditioning specialists are professionals who apply scientific knowledge to train athletes who are really trying to achieve the goal of improving athletic performance. They conduct sport specific testing sessions and design and implement safe and effective strength training and conditioning programs to provide guidance regarding nutrition and injury prevention. Now, for physical therapy, the American Board of Physical Therapy Specialties offers board certification in 10 specialty areas of physical therapy, which are cardiovascular and pulmonary, clinical electrophysiology, geriatrics, neurology, oncology, orthopedics, pediatrics, sports, women's health, and wound management. So, employment opportunities. I researched some employment opportunities for these two careers, and this is what I found. For strength and conditioning coaching, that will either be at a high school or a university of some sort, as well as athletic trainer, but also exercise physiologist and physical therapist. Now, for physical therapy, the employment opportunities are for outpatient clinics or private practices, sports, fitness and wellness centers, occupational or workplace environments, home health care and hospice, rehab hospitals, subacute rehab facilities, extended care centers, nursing homes, and skilled nursing facilities. Now, potential salary. Obviously, the strength and conditioning would be a strength and conditioning coach, and they have an average salary of 48,000, which is just under 50,000. Now, for physical therapy, their average salary is around 70,000, and that's because they're directly involved with different type of medical conditions, down from a thumb sprain or to anything like a disability, for example, like strokes. Specialized knowledge and skills. So for strength and conditioning, kinesiology is a big thing, especially anatomy and biomechanics, exercise physiology, basic nutrition, and weight management and human behavior. Not a lot of people know that being in the field of any type of exercise science or strength and conditioning, you want to have some sort of psychology courses once you're in school. Um, it helps a lot. Being able to, learn how to deal with different types of people or people that you train or anything. Have a physical therapy, reading comprehension, communication and listening, giving healthcare instructions, operating medical diagnostic equipment, planning healthcare treatments, and treating a wide variety of physical problems. Education, certification, and training. Now, for strength and conditioning, the CSCS certification is seen as the gold standard for strength and conditioning coaches. But the only requirement for that is just any type of bachelor's degree. It does not have to be in exercise science or kinesiology. It can be any bachelor's degree. Now, for physical therapist, you have to earn a doctor of physical therapy degree from a commission on accreditation in physical therapy education. Sounds like a lot, but that's just something you have to do. when you want to be a physical therapist. And the length of the program is usually 3 years or so, depending on the person. Now, the work environment. So, strength and conditioning. So, strength and conditioning coach, they usually work under a director. It can either be a director of strength and conditioning or a director of athletics. They're typically at universities or high schools, and they work with the student athletes there. But a lot of them, they work for professional or semi-professional teams. Now, for physical therapy, they spend a lot of time, a lot of their days on their feet. And they work in private offices, clinics, hospitals, homes of some patients, or even nursing homes. Now, for strength and conditioning, strength and conditioning is my number one career of choice. And right now in my life, one of my biggest passions is playing football. But I do understand that football is not a thing that you can play forever because it's very dangerous. But one thing I do know that I can be a part of the game if I'm not playing it. If I'm a strength and conditioning coach, and a few pros of strength and conditioning coaching is being a part of something that I would love to do. I will get to stay in shape, um, and I light work during the summer, and I'll also help young athletes become better athletes. Some cons that I will be really busy during the fall, winter, and spring, as those are months that athletes are very active. Another Another con is that I would spend a lot of time away from home during the fall. The fall time is football season, obviously, and usually the strength staff they travel with the team, whether it's away or home games. Um, but also, it gives you a variety of employment opportunities. And with this degree, well, it's not a degree in physical therapy, but with this certificate, you can do a bunch of different things, even physical therapy, which is my second choice. But I'm still very interested in strength and conditioning. It's my number one career choice, and I plan to go through with it. But one thing that sticks out with me is that I can help people with the same passion as me become successful at that passion. And it means a lot to me to be able to help someone do that. Now, for physical therapy, it's my second option, but it's a more in-depth thing as far as healing and treatment. It requires more years of schooling, but obviously more comes out of that. Um, but some pros for physical therapy, of course, higher pay. The balance of life and work is very good. You can work in different places, and it's a high demand job opportunity. Um, One specific con that stuck out to me was that the schooling is very expensive. And, but one thing that I like about physical therapy is that you can help people with certain, issues, health issues or physical issues. You can help them get better at those things that they struggle with. For example, if someone gets into a car accident and they have to learn how to walk again, I feel like being a part of that, helping them do that, is just a major thing to that person. And I mean, who wouldn't want to help someone do something you know that's that life changing? Um, However, the schooling portion, that's one thing I don't really prefer. But things can change. Um, but anywho, these are my resources, and I hope you enjoy my presentation. And you have a good night.